Well, of course, I think you need to be clear that Southeast Asia is not really homogeneous, so there are differences. But if you speak generally across developing countries, I think there are six primary barriers. The first one clearly is the shortage of health workers at all levels, be it doctors, nurses, birth attendants, laboratory diagnostic workers. So that's the first one. Second barrier is poor information, that many health systems in this part of the world do not have reliable data even on basic health statistics in terms of how many people die and what did they die of. So poor information is the second one. The third one is in relation to infrastructure, poorly equipped hospitals, health clinics that do not have even basic medications or services. The fourth one that's also very important is money, financing. In many countries, and China is probably a very good example, you have a very inequitable spread between those who can afford to pay for healthcare and those, because they have to pay out of their own pocket, are actually going into poverty as a result of not being covered by any national scheme of insurance. So financing is the other barrier to having an effective system. And the last two pertains to, firstly, poor coordination. Many countries in Southeast Asia are decentralizing. So you have a problem of coordination between the health delivery system at the level of the province, at the level of the district, and also with the national level where the policies are set. So there is sort of internal lack of coordination. And there also lack of coordination between different parts of the healthcare system, like those who purchase the drugs as opposed to those who deliver the drugs, as opposed to those who collect the information on which diseases are more prevalent. So there's another lack of coordination there. And the final barrier, which in many ways is the most important, especially in times of limited resources because of the financial crisis, is that many healthcare delivery systems do not use scientific evidence in terms of when they are making policy decisions. And in many cases, there's a lot of wastage in terms of development of policies to decide on a particular drug, which the evidence says either it's not going to work or it's too expensive, in other words, not cost effective, or in some cases even harmful. So in sort of general terms, those I feel are the six primary barriers to having an effective healthcare system. Yeah, I think maybe the last one is the one that I want to elaborate on. I think it's absolutely critical that the gap between the policymakers in the Ministry of Health and the researchers in the country who provide the necessary evidence, that gap must be bridged. And one pragmatic solution to that is to actually have a cadre of people which are known as knowledge brokers. Now, scientists are not usually the best people to speak to politicians, and politicians inherently don't trust scientists. So you need a cadre of people who are knowledge brokers, we call them, and that model has been tested in many developed countries to very good effect. So these are people who understand the science, but who also know how to present science to a policymaker so that he sees the value of that scientific evidence for his decision making. Because at the end of the day, no politician, no policymaker wants to make bad policy. But if the evidence that he so badly needs is not presented in a way that he can understand, he's just going to ignore it. Okay? So that's one pragmatic solution. The other solution is in the context of the shortage of health workers. Okay? One possible solution that has been tested actually in many developing countries in Africa is something called task shifting. Now there is this myth that for many medical procedures you need a doctor. Okay? Now it turns out that once you do the research, and this is all evidence-based, some tasks can actually be shifted either to what we call sort of medical attendants or even to nurses and in the case of reproductive health, maybe even to midwives. So in that sense, a shortage of qualified doctors should not prevent you in certain situations, like dispensing a standard antibiotic when what are the likely causes. A paramedic can do that. Simple, basic surgical procedures. So that's known as task shifting. So that's another way of overcoming the shortage of doctors, for example. And then there is the big problem that we see in this part of the world is the brain drain. Many nurses from the Philippines, for example, are leaving for the United States. So how do you prevent that? And there are many sort of ideas about how to do that. And the WHO, for example, is drafting a code of practice so that countries do not consciously try to recruit personnel from developing countries, and if they choose to do so, to somehow compensate the country so that they can replace the lost health workers. Now, just as an anecdote, Thailand actually has no problem of their nurses wanting to migrate to greener pastures. You know why? Because they're very pragmatic. They didn't teach them how to speak English. Okay? So Thailand has no problem. So, that's just an anecdote, but there was a very serious intention behind that because they could see what was happening in the Philippines. They could see what was happening in South Africa, If you speak English, you are much more marketable. So that's just two pragmatic solutions on some of those barriers. Yeah. Now, in a sense, the way you presented it, as if they were mutually exclusive. In fact, they're not. Okay, because when you say primary healthcare provision, it also includes health promotion activities. Okay, educational activities. I think that's considered to be part of primary healthcare provision. But if you sort of look at it broadly, when you say health promotion, you're focusing mainly on preventive aspects, okay, promoting healthy behaviors. Whereas when you say primary healthcare provision, you're talking more about reactive, curative. So it's, preventive versus curative, providing drugs, for example. But provision can actually also be preventive, because if you give a vaccine, that's not to treat a disease, that's to prevent a disease. So, it's not black and white. But I'm digressing here. If you ask me what's the right balance between the two, generally speaking, I would say a lot more should be focused on promotion. Okay? A lot more should be tilted towards prevention rather than cure. Okay? Preventive rather than reactive, if you like. And I say that for 4 reasons. First, purely cost. It's a lot cheaper to prevent a disease than to treat it. I'll give you one good example. Despite all the price drops that have happened for treating HIV/AIDS, okay, the cost of treatment for HIV/AIDS is still, on average, despite all the price reductions, $10,000 a year. Okay, now you compare that to the price of a condom to prevent it in the first place. It's a no-brainer. Yeah. Okay, so the cost angle is the first one. The second one is that preventive medicine, sort of promotion, health promotion, applies across all the major disease areas. Now, if you look at what people are dying of globally, about 80% in total die from either infectious disease or chronic disease. Now, health promotion, in the context of infectious disease, if you teach people how to wash hands, okay, after they go to the toilet, that's a very effective preventive measure against diarrhea, for example, even against avian influenza, personal hygiene. If you teach people to use condoms for safe sex, that's a very effective promotion. And what's good about it is that it empowers people. It allows them, based on knowledge, acceptance of the scientific fact, they can then change their behavior. So it's using science to alter behavior towards more healthy behavior. So that's for infectious diseases. I'm just using 2 examples, washing hands and using condoms. The impact of promotion, health promotion, is even greater when you talk about chronic diseases. Okay, I'm talking about heart disease, diabetes, cancer. You know, the potential, for example, of telling people don't smoke, the potential of saying watch your diet, avoid fatty foods, the potential of saying exercise regularly, okay, the potential of saying don't drink too much alcohol. You know, that applies equally to chronic diseases. And the cost of caring for someone with diabetes is a lot more expensive than treating someone with an infection. If you get an infection, I give you a dose of antibiotics, 2 weeks later you're cured. If you get diabetes, the burden on the healthcare system is for the rest of your life. And it's the same with heart disease. If you get a stroke and cancer, you know, so in that sense, the promotion is I feel should be given more emphasis because it applies across both these big group of diseases. The third one is sustainability, because if you succeed in promoting healthy behaviors, that is very sustainable because parents can pass it to the children just because the children watch them do it. Schools can play a very important role in inculcating this kind of behavior. So it becomes a very sustainable thing. Whereas people have this perverse habit that if you get sick, you get treated. Do you think you learn from that? Sometimes you don't, right? You know, you forget. Once you're well, you forget, and then the same thing happens. Whereas promoting healthy behaviors becomes a daily habit. You know, washing hands, sneezing into tissue instead of, avoiding crowded spaces during epidemics. So it's sustainable. That's the other issue. And I think the last reason why I say that is that health promotion is now very, very suited for the advances in communication and information technology. You know, you're not just limited to printed educational materials. You can use videos, you can use Facebook, you can use Twitter, you can use podcasts. You know, this whole array of sort of new media tools can be used for promotion. And it's not limited just to people who have internet access. In villages in Africa, people are being very innovative about using songs, about using plays to send a message, for example, about safe sex using condoms. So it is very amenable to all different kinds of dissemination techniques. So I think for those 4 reasons, and I think the cost one is a very powerful argument. It's much cheaper to prevent than to treat.